I really like learning about this unit with the incivility. Unfortunately, mild incivility seems to be pretty common in workplaces that I've been in. Thankfully, at the U of U, everyone's been pretty nice and whatnot. So, one thing I really liked learning about in this unit were the four steps in the DSC script, which is describing the situation, expressing how the situation makes you feel, suggesting other alternatives, and seeking an agreement, and consequences that should be swayed in terms of impact on team goals. At the U of U that I work, the unit I work in right now, they're very good at helping others. But in other workplaces that I've been in, there's quite a bit of uncivil behaviors. But I feel that was primarily due to lack of experience in the workforce and the sorry, my allergies, and the people that work there. Quite a few of the places I worked at were, I'm not trying to stereotype at all, but were had quite a bit of young people, some still in high school, and a lot of the times it was understaffed, so there's just a high level of stress, and typically the length of time that people work there was pretty low. Like, it was usually a turnover rate of about 3 months. But in regards to the questions for this week, how does this apply to your nursing practice as a new grad? As a new grad, I will maintain professionalism and help others as much as I can. I would also not be uncivil to others, as it just creates a toxic work environment. And people, not only the patients or residents, but family members can also see how that affects like their care. And a few residents in long-term care facilities that I worked in actually verbalized that to managers, and unfortunately, with a high turnover rate, nothing could really be done because the next month there's a new person, and same cycle went over again. Let's see. Incivility also affects healthcare from an individual level, as the nurse not feeling welcome or a valued member of the team, to entire workforce that are not in sync and have a high turnover rate. All this again returns to the value of care the patient receives. With good work culture, patients will receive the best care possible, as all team members are willing to help each other out and use good constructive criticism when needed. What is your personal experience with this in your professional life? When I was a new CNA, amidst COVID and everything, I became a CNA in March or February of 2020. I was uncomfortable doing a bed change by myself because the patient was a little bit heavier set, and I was afraid that I would hurt them by trying to move them. And they had chronic pain as well. So I went to ask my coworker for help, and she literally just water-flying to me, looking at her phone, saying, "Why can't you do this yourself? Like, you're expected to do that yourself." And it was true, because after you're trained in that facility, you were required to have like entire unit all by yourself, doing med pass and taking care of the residents. But I just felt terrible after that, because the moment she was done helping me, she left without saying a word. And then it was just never brought up again. But I went home that day thinking, like, man, I can't even like move a patient who needed a bed change by myself. Like, all these other people are doing it, why can't I? And it was at that moment that a friend of mine told me, like, it's not me, it's them being understaffed, and her verbalizing or displacing feelings on me regarding the stress of that situation as well. Is this something you can apply to your capstone experience? Definitely, as I am learning everything that is required of the position, and I just want to be able to do it in their protocol manner. I don't want to just assume that I'm doing something right when I don't feel completely comfortable doing it. So I've definitely been asking for help, and thankfully coworkers are pretty nice about offering it. What are some barriers or challenges you may face? Some barriers or challenges that I may face is if there are any people that will stereotype me. Growing up, I had a speech impediment, and I still have a remaining list from that. And in speech therapy, I was taught to like slow down my talking and like enunciate as much as I could. So in my previous job, some coworkers and employers were shocked that I learned things quickly and that I was actually smart. In one retail job, I had one person even stated that they thought I was dumb because I had a lisp. And then they were shocked that I actually learned things within like a week compared to others that took a little bit longer. How does this influence your clinical decision making? By using what I learned in this module properly, I'll be able to use everything I know to help patients that will be taken care of, and will be able to provide them the most appropriate care, either by myself or with the help of others. Thank you.